I'm certainly a misfit here. Neither I'm an Korean nor I'm an American. I'm basically.
But you are welcome. You're welcome
No
here.
way.
Yeah.
Can't believe this.
I did my neurosurgery residence in India, and my seniors were all going to Korea for fellowships or observerships, and I was applying, I was not getting it, or I was not affording it, and somehow I landed up to be in the United States, and I was very, very lucky enough to be in Mayo Clinic, Arizona, to get a spine fellowship, and I became second time lucky to be here and to present our small work after those speeches of the awesome speakers and awesome discussions. I don't deny that I'm pretty much scared. So when I say that single-stage combined anterior posterior surgery is rarely performed, I mean, this is not my line. I copied from one paper. I think this is a recent paper. I think the authors tried to mention that there is not 10 meta-analysis in this topic probably, but yes, this is not a new concept. Everybody is doing probably, but probably a little less practiced. This has been described for pseudoarthrosis, adjacent segment disease, hardware failure, sometimes multi-segment disease in novel and virgin cases, or sometimes to correct the cervical kyphosis or the deformities. So whether there may be a discussion between like whether to perform this surgery in a same day or staged manner. So same day surgery may give immediate rigid stabilization and may be superior in terms of estimated blood loss and length of stay. So this is a retrospective study, very small population, just 12 patients, this by single surgeon, and my boss is in practice for just 4 years, so the patient load is just 12. Just regular clinical parameters, radiological parameters, and operative details. I will not go in the details of that because everybody knows. I will just show our results and discuss few cases. So already Dr. Sheen has given a wonderful presentation about the cervical deformity and measuring all the angles. So we did just a couple of them, which following Tong's 3 stage articles in neurosurgery. The first one, I just measured those one, measuring the cervical lordosis and C2, C7 SVAs, chin bow vertical angle, and T1 slope, TIA, and neck tilt. So our results are, so these are our demographic studies, 12 patients. In America, we do see most of the patients are obese, and like high morbid BMI. Some of them are malnourished also, so we have to keep those populations who are like 70s with malnourished, those also to be in mind. I think nobody is surprised that all of them are former smoker. One was actually active smoker. We wanted to deny the case, but she is an international patient and her visa will expire and she will not be able to come back again. So we had to give like 1 week gap and operate. This is our surgical data. Most of the patients were previously operated. Couple of them are never operated, but they had multi-segments disease. When I say this is the average surgical time, if the surgical time is more, then it is my fault. And if the EBL is less, then the anesthetist was generous to document less. And if it is more, then again it's my fault. So these are the radiological parameters. You can see that most of the patients had cervical kyphosis, or at least there was a loss of lordosis. But they are not really deformity, means we don't have any patients SBA more than 40. There were like 33s, and T1 slope was also less than 40. So it's not really a deformity, but mostly ASD or a pseudoarthrosis kind of. So outcome analysis, most of the patients are improved. But again, follow-up period is not that great to comment, have a final say on that. We did have a patient who had a wound complication. One patient had transient dysphagia, but he has improved. One patient has recurrent of neck pain, but we are still searching for the cause. And one patient is unchanged. So a couple of quick cases. This first patient, never operated. You can see there is loss of cervical lordosis, 68-year-old male, and presented with one radical, means there's a myelopathic signs also. Some radicals are involved. There's hand pain. And then a patient underwent 4-level anterior surgery, anterior approach, and 5-level on the left side. One C6 pedicle screw was skipped on the right side. Patient did great after the surgery. Now the second patient, this is a case of pseudoarthrosis, again loss of lordosis, a bit of kyphosis almost, and you can see that it has not fused on that level, so we had to go ahead and do 5 levels of front and 6 levels of back surgery. Patient did great initially, but looks like some recurrence of pain is there again. The third patient, this is a patient of a young patient. This is a patient who was smoking, and she's a Ehlers-Danlos syndrome patient. You can see she has hypermobility, and she went the left side. She underwent 2 surgeries earlier by different surgeon. Unfortunately, I'm not sure what was exact thought process, but first surgery they did a C1, C2 fusion posteriorly, and then second one C3 to 6 fusion, but there was nothing in between, and she was having severe pain from pseudoarthrosis and radical pain, and then she ended up with us. So we did a multi-level anterior approach, and we put the graft there, but we didn't really put a plate and screw front from the front, and then we went back and then did a multi-level lateral mass and pedicle screw. She did great after the surgery. How do we know? She kind of posts in her social media every month, so we don't really need a follow-up. Our nurse follows her in social media, and she tells us. So the only question we ask that whether she's abusing us or she's happy. So looks like this is July 4th, and she looks happy. So this is, I will show 2 articles. The first one shows that the posterior approach was superior to combined approach in terms of surgical cost, surgical time, blood loss, complication rate. But this came in same year, just a year back, that shows that just the opposite, as you expect. So limitation of present study is obviously retrospective study, small number, no long-term follow-up, but it can be another addition to the available literature. So combined anterior posterior surgery is a relatively new concept probably for cervical sagittal malalignment. Can be performed in a single day or in a staged manner. Single stage surgery has excellent outcome with minor complications. I'm very fortunate to work here, and right side is my mentor and wonderful person. Thank you so much.